I'm Kelly Warner. There are three main treatments for breast cancer. The most common is surgery, which is often accompanied by chemotherapy or radiation or both. When Debbie Roberts-Sorg's doctor recommended radiation therapy to treat her cancer, she had a lot of questions, and she wasn't afraid to ask them. Debbie Roberts-Sorg is a crafter, scrapbooking, sewing, and most recently, painting and card making. Call it her creative outlet, her self-proclaimed happy place.
This is, I guess, my only scrapbook that's complete.
This retired teacher is also a breast cancer survivor, diagnosed with invasive ductal carcinoma after a routine mammogram in January of 2016.
My mother actually had breast cancer, so I'm very diligent about doing my yearly exams.
Debbie says she was fortunate. Her cancer was caught early. She underwent surgery, then radiation therapy.
So the treatment is taken on a different form in that it's much more elaborate than it was 20 years ago.
Emily Dunn, a radiation oncologist at Willamette Valley Cancer Institute, where Debbie received treatment, says advances in technology have made radiation therapy more precise and individualized to each patient.
What we do now when we're treating for breast cancer is we're monitoring radiation not only to what we're trying to target, the breast and possibly the lymph node areas, but also what we don't want to target, the heart and the lungs.
Standard radiation therapy is given in short daily treatments, 5 days a week for 5 to 6 weeks.
Well, it wasn't that bad. It really wasn't. It's just you lay there, for me, not even 5 minutes.
And patients often ask if the radiation hurts, and it doesn't. So what we're treating you with is high-powered x-rays. So you're not going to feel the radiation treatment. You'll hear the machine click on and off. You'll notice that you're the only person in the room receiving treatment, but we can see you and hear you on our private screens and make sure that everything is going well.
Since her diagnosis, Debbie and her husband Gary have made it a point to slow down, taking time to fully appreciate life. Debbie encourages other women to get their annual screenings and to ask questions if something doesn't feel right.
That's my biggest thing to say is ask, and be your best advocate.
As with most cancer treatments, radiation therapy can have side effects, which vary from person to person. Debbie experienced fatigue, but others may experience mild or intense skin irritation, similar to a sunburn. For more information on radiation therapy, head to OregonCancer.com. I'm Kelly Warner.